Recently, we were able to interview both Matt Jensen and Vance Thompson from Vance Thompson Vision in Sioux Falls, South Dakota. Through them, I've been able to meet a unique individual. He's a doctor and a type of doctor that we see occasionally when we're kind of achy and not feeling so good, maybe a little stiff. He's a chiropractor, and he's not just any chiropractor. He's one of the leading chiropractors in the country, and I'm going to say the world. And it's a pleasure for me to be able to introduce Dr. Nathan Unruh. Nathan, welcome to the program.
Thanks, Sharif. We're happy to be here. That's quite the introduction. Thank you.
Well, I can tell just even by your setup, you do this as part of what you do. So please tell us a little bit about yourself and a little bit about Sidecar and what you do to help doctors around the world.
Yeah, Sharif, I've cut my teeth as a doctor of chiropractic. I've been a doctor for 20 years, and we have a couple of practices we still own and operate. But with that, over the years, I had a passion of helping other doctors. And so we started a company called Sidecar, which is really what we do is business development. And also we provide billing for doctors all around the country. And so we serve about 300 doctors right now currently through Sidecar. And so really what we really focus on is much like what you focus on. How do we take care of people better? How do we give them a better experience?
Well, there's a chiropractor everywhere I turn in my town, right? There's in the medical professional buildings and in the little mini malls and stuff like that. So, how do you differentiate for you and your clients what you do versus everyone else in the community?
Yeah, great question. And that's something that a lot of doctors will ask because you're right. I can walk out my doors and within 2 blocks, there's multiple other doctors of chiropractic. And so how we differentiate ourselves is on the experience. And people say, well, everyone's talking about customer service. Everybody talks about the experience. But I said, when you start to understand the components of an experience, and that really starts at an operational level, because we have a tendency, Sharif, I don't care what type of discipline as a doctor, we always have a tendency to look through the doctor's eyes and not the patient's eyes. And so what are the patients wanting? What are they saying? And so we've done hundreds, if not thousands, of just one-on-ones like you and I are doing right now, and asking patients, what do they want? We've studied to research, what are some of the biggest reasons people leave a doctor? And you know what the number one reason is?
Tell me.
Perceived indifference. 68% of people leave their doctor or even just place of business because of perceived indifference. Now think about that in our world of being doctors. Perceived indifference shows up by the gal sitting at the front that never picks her head up, who says, oh, we're full when you call on the phone, or it's not clean, it doesn't smell right, visually it's not right. All the tiny little things, or for some reason, my time's not important as a patient as I sit in the waiting room. I mean, just think about the terminology that we use, the waiting room, and sitting there for 2 or 3 hours waiting for the almighty doctor. It's just backward, right? And so patients deserve better.
Well, you're singing to me with that one. And let's go back. How did you first kind of get turned on to this whole idea?
Trying to just in early days of when I first read one of my favorite books, The Experience Economy by Joe Pine and Jim Gilmore, it resonated with me. It resonated with, hey, there's these 5 components of a transformational experience that needs to be in healthcare. And then I started to go and say, okay, I read every book I possibly could. One of our textbooks is called The E-Myth Chiropractor. And still, if you look at the E-Myth, the very first one was written back in the 80s and even still to this day is considered one of the top 5 business books.
Yeah, yes.
So I started pulling apart systems and procedures, but going, okay, what about the experience? How do we systematize the experience and be very intentional? And like you've read it, you're one of their guys, Joe and Jim, of you have to stage these things.
Yes.
Down to the tiniest of details.
Well, you're right. And, I was privileged to have Pine and Gilmore write the foreword to my book. And it was a great honor for me to have them do that. So, yes, you and I probably, we're in sync on a lot of things in this world about what healthcare can be like and what's possible. And, I mentioned Vance Thompson, who's your neighbor there in Sioux Falls. And when I show an image of his facility there, which you can see from the highway, I say, look, this is a medical facility, and people are stunned when they see it,
Right.
especially when it's lit up at night.
Yes.
And I'd say to people, you don't need to do what Vance Thompson Vision did,
Yeah.
because it's a huge investment, but it does show you what is possible in healthcare, what is
Yes.
possible in terms of the environment.
Yeah, and I'm always inspired every time I go over there. In fact, Vance is going to be operating on my eyes here in May, and I'm just
Congratulations.
yes, I can't wait. But you know, I'm always inspired what him and Matt Jensen have been able to do, and it truly is what the patient experience is supposed to be all about.
Yeah, yeah.
Taking care of all the little things.
So you had talked about what patients really want, and if you talked about why they leave. So if you were to kind of list out, bullet point out, maybe the top 4 or 5 things in terms of principles that you teach to your practices, what would they be around what patients really want?
Yeah, great question. I think the biggest things is number one is time. They want you to honor their time. Time is the currency of experiences. And so, of all of the surveys we've ever done, all of the focus groups we've ever done, it always comes down to 2 things. Please just honor my time and honor my money. And I think in today, if you look at in my specialty of chiropractic, 85% of the fee is paid by the patient. And so therefore they have choices. And as doctors for many years, we didn't really treat the patient like they had choices. And so we have to make sure that we develop systems and procedures to be very intentional about honoring their time.
Mm-hmm.
And it's not always around the quantity of time, but the quality of time. How we refer to them. People don't want to be treated like these humanoid widgets or robots. And too many times that's how they're treated. And I think
Mm-hmm.
healthcare is become one of the worst. And we need to catch up in all disciplines in understanding how can we improve the overall human experience.
Yeah, absolutely. What else?
So time would be number one. Money is number two. Number three is making sure that this whole idea of perceived indifference. And we could rant on that for this whole time together with you, Sharif, but it's how do you really look at your team? So the doctor might, I love the name of your book, Beyond Bedside Manner. So the beyond, how about how you're training your team?
Mm-hmm.
One of the biggest things when I talk to doctors is that they say, well, we offer great care. The doctor's so wonderful. Well, tell me about your development system. And they say, well, I don't really have one. Mary, Mary, who's been here for 15 years, she's the one who trains so-and-so and so-and-so trains so-and-so. So we have all of this duct tape procedures and systems together. And so what we really look at is saying, how are we going to get beyond perceived indifference is going to make sure that we have a great development system. And a great development system has to have repetition.
Yes.
So I look at all the insights within your book. Every one of those insights, if I only read them one time, Sharif, I'm just exposed to some good information.
Right.
But I have to go over them and put them into a system and a procedure in order for them to get into the DNA of the organization. So number one, you got to have great content and development system. Number two, you got to have repetition. Number three, you got to be able to practice and role play that with the team. If you look at the practices that are doing it great, whether it be an eye doctor, a chiropractor, a surgeon, the people who are practicing and role playing and have a system to do that, they're the ones that are winning. And then we have to be able to track, measure, and monitor that training. So again, I think to answer your question, number one was time. Number two is money. Number three is just the lack of training of our teams.
Mm-hmm.
We got to have everybody in alignment.
Yeah, I think you're right. A lot of these concepts, it's the first step. It's exposure. And
right.
even with the book, 57 insights that are from across kind of the arc of my career that put into a single volume. And, my goal and my hope is that as doctors and their teams read it, that it sparks the thought. Some doctors will have already done many of these things. Some doctors will have done very few, but every doctor can find something that they can work
Absolutely.
on. And my
Yes.
counsel is to pick the one or two things that resonate the most and focus on that, get a little victory going, see some improvement, and then they'll be motivated. They'll be self-motivated to want to do more, to keep going beyond.
Yeah, absolutely. As you're saying that, and you were telling me more about you and what you've done in working up to this in your life, you did a lot of work on the technology side.
Yeah.
So you were
Yeah.
really helping doctors become better technicians. Would that be fair to say?
Yes, and the technology enabled them to do things that they couldn't have done previously. I mean, imagine now this magic laser and kind of 15 to 20 minutes of kind of total time under the laser, and a patient gets their vision
I
restored.
know, it's
I mean,
amazing.
that's biblical.
It is amazing. It's so amazing. It really is.
So
Yeah.
technology is incredible, but I've
Yeah.
been saying to some of our corporate partners here who are interested in getting the book for their sales forces and for their customers is that if technology was the answer, we'd know by now.
That's
And
right.
the elective services market could be far larger,
Yeah.
I believe. And I'll ask you, do you believe it would be a lot larger if more practitioners and practices focused on patient experience?
I think absolutely. Yeah. And that's why I was asking the question is that really, let's go back to what patients want. And in number one, when you're looking at technology or the technician component, when a patient comes to see us, they expect great clinical results.
Mhm.
So clinical mastery is absolutely a must. The tendency, though, as doctors, that's all we focus on. Let's just go get the next technology. So, like you just said, let's make that the differentiator. Well, anybody can go get the next technology. The next guy's going to get the next technology. But the other two components are number one, financial accuracy.
Mhm.
So many times I love the doctor, I love the staff, but they screw up my bill every single time I go in there. That creates perceived indifference and the patient leaves.
Interesting. Yeah, I can see it. I can
And
see
then,
it.
and then the third component would be customer fulfillment. And that's all the things. That's your 57 insights. As you dive down, those are all the tiny little things that make the experience special. So again, just clinical mastery, patients expect to get results. Number two, financial accuracy, honor their money. And number three, customer fulfillment. That's how the place smells, how it feels, how the people take care of them. And it's again, even just the word patient kind of gets messed up. How about seeing the person in the patient?
Mhm.
And
Mhm.
so I know even with our teams and what we teach is we look at every single human being is different. We have different behavioral styles. So how do we teach our people and ourselves to communicate differently? So when you talk about bedside manner, like those are the doctors that just kind of had it, right? They had that ability to communicate. Well, we have to be intentional of saying your needs when you walk into a place and the way that you communicate is different maybe than mine.
Right.
And so understanding human behavior and learning to communicate according to and recognizing that human behavior, just that alone makes such a huge improvement in the overall experience.
Oh, that's great. That's great. I'm just the success you've been able to achieve in helping practices now in the hundreds is not surprising. It can't be just based on even passion or will. It has to be the systems and the operational
Absolutely.
improvement and the way to track that. And what you've been talking about today applies to every specialty, right? Every doctor. And, I focus more on the private practice. I'm not trying to tackle hospitals and hospital systems. That's a
That's another
big
animal.
nut to crack,
Yeah.
but we've got a lot of work to do here. But, if doctors kind of think about, Nathan, what they do, my sense is, they're told in medical school, in chiropractic college, bedside manner is important, right? But it's almost like it's almost a throwaway line.
Right.
And it's because bedside manner was something that, we kind of know what that's about. And as I've said to others, it was the original customer survey in medicine,
Yes.
right? Doctor and the nurse either had good or bad, or poor bedside manner, and that's not good enough. In other words, it's important to be nice, but
Yeah,
being nice isn't sufficient. You've got to have these operational systems in place. And
absolutely.
I'm so glad to do that. And we're going to put a link to your website at the end of this if people want to learn more. And we end these. It's called Pep Talk for a reason. We
Yeah.
ask each guest just to give a little bit of inspiration to the doctors out there and their team members that are listening to this. So please go ahead.
Well, the thing that we always look at as teams, and I have to look at myself every single day, is how do we judge success? And I look at it in three ways as we look at taking care of people. And I call it the 3 H's: heart, humility, and hustle. Have the heart to serve bigger than way beyond your own needs. And I think Jesus was a great example when he walked into the room with the 12 disciples, and the first thing he did is wash their feet.
Mm.
It was a sign of servant leadership. I think as doctors, the word doctor means to teach. I think if we come from that end, always serve. Heart, number one. Humility. Humility means we got to come every single day with a humble mind and a mind to expand our mindset, to say, hey, you know what? We can do this better. I don't have to have all the answers. In fact, if I got to be the smartest guy in the room, I better change rooms. And so having conversations like you and I are having right now, going in and implementing the 57 insights, that shows humility. And then lastly, hustle. And the hustle muscle is always like, how bad do you want it? You know, I mean, and where is your hustle muscle at? But if you incorporate those 3 H's into every interaction and how you live your life, I believe the world's gonna be a better place.
Wow. Thank you. That's powerful. Everybody, Nathan Unruh, Sioux Falls, South Dakota. Nathan, thanks so much for being a guest on the program today.
It's my pleasure. Thanks for having me.
That's all the time we have today. I'm Sharif Madavi. Until next time, be safe, wash your hands, love your pets. Take care.